Hello and welcome to my channel. In this lecture we will be discussing the pelvic vessels, so let's begin. The common iliac arteries, they are the terminal branches of the aorta and begin at the level of L4 and descend till the level of the lumbosacral disc, where they divide into internal and external iliac arteries. The internal iliac artery is distant to the pelvis and the gluteal region, and the external iliac artery is distant to the lower limb. Now, for the right common iliac artery, it's around 5 centimeters long. Anteriorly, it has the ureter, the peritoneum, the small intestine, the sympathetic branches to the superior hypogastric plexus. All these cross the right common iliac artery. Posteriorly, it has the lumbosacral trunk, and the sympathetic chain, and the beginning of the inferior vena cava, as you can see here. Please observe this, because it's a common question. Where does the inferior vena cava starts? It starts posterior to the common iliac artery by the joining of the two common iliac veins. Okay, and the obturator nerve and the iliolumbar artery. All these are posterior relations to the right common iliac artery. The left common iliac artery, however, is slightly shorter than the right. It anterior also has the sympathetic branches to the superior hypogastric plexus. It has the ureter and the superior rectal artery. Posteriorly, it has the sympathetic chain, lumbosacral trunk, obturator nerve, the iliolumbar artery, and the left common iliac vein, partly medial and partly posterior. You can see that with the left common iliac artery. The internal iliac artery, level with the lumbosacral disc. It's anterior to the sacroiliac joint and descends to the superior margin of the greater sciatic notch, where it divides into anterior and posterior divisions. The anterior division is considered a continuation of the internal iliac artery. This is the internal iliac artery, see, dividing into anterior division and posterior division. Anteriorly, it has the ureter, and it's a boundary of the ovarium fossa. Remember, it was a posterior boundary to the ovary, so it has the ovary and the ureter in front of it. Posteriorly, it has the lumbosacral trunk and the sacroiliac joint with the internal iliac vein, as you can see here. Medially, it's the peritoneum separating from the terminal ileum on the right and the sigmoid colon on the left. Laterally, it has the obturator nerve, the psoas major muscle, and the external iliac vein, as you can see here. This is the external iliac vein. So this is the internal iliac artery. See, it gives many branches, especially from its anterior division. In the fetus, you see this branch coming out of the internal iliac, gives the umbilical artery. See that? Goes to the anterior abdominal wall. It's obliterated now. It's obliterated. It's the remnant of the umbilical artery. Umbilical artery carries deoxygenated blood out of the body. After delivery, it becomes obliterated, and the obliteration goes to the superior vesical branch, proximal part. So this is the obliterated umbilical artery we were talking about, as considered as a branch of the internal iliac, but it's an obliterated branch, has no blood flow in it. Remember, it raises the lateral umbilical fold. Exactly. Branches of the anterior trunk. We have the superior vesical branches. This is the superior vesicle. See, superior and inferior vesical branches. It supplies the vas deferens, supplies the superior parts of the urinary bladder and the seminal vesicles. Inferior vesicle completes the job inferiorly by supplying the posterior surface of the urinary bladder and the seminal vesicles. The middle rectal artery in the lateral ligament of the rectum, and we talked about it with the rectum. It's where it supplies only the muscle wall and does not reach the mucosa. And of course the uterine artery, which we studied its detailed course with the female reproductive system. So these are branches of some branches of the anterior trunk. We'll continue with the branches. The obturator artery. This is the obturator artery. See, it's above the obturator vein and the obturator nerve above it. So van from below upwards, vein, artery, and nerve entering. As you can see, it enters the obturator canal on the lateral pelvic wall above the obturator internus. Medially, it's crossed by the ureter and vas, peritoneum, and ovary. And as we said, the obturator nerve is above it. Remember this arrangement at the obturator canal: the vein, artery, and nerve from below upwards. The obturator artery gives iliac branches, vesical branches, and the pubic branch. You can see this pubic branch from the obturator artery. The pubic branch anastomoses with the pubic branch of the inferior epigastric artery, and sometimes this anastomosis replaces the obturator artery. Means the obturator artery itself ends here, and the anastomosis continues as if the obturator coming from the inferior epigastric artery. I've seen this in cadavers, and that's why you get questions about this topic, the pubic branch of the obturator artery. The internal pudendal artery. This is the internal pudendal artery. See, this is the inferior gluteal, and this is the internal pudendal artery. The internal pudendal artery, it's one of two terminal branches, anterior to the sacral plexus, as you can see here, and the piriformis, and inferior gluteal artery, anterior to inferior gluteal artery, curves around the ischial spine, the pudendal nerve being at the apex of the spine medially, and the nerve to obturator internus at the base of the spine laterally. This crosses or curves around the spine in between these two structures. Supplies the external genitalia. The inferior gluteal artery is a large terminal branch and passes between S1 and S2 to exit the pelvis, and you see it here. This is the inferior gluteal artery coming out below the piriformis and the gluteal region. You see it will supply the surrounding area, the surrounding muscles. Branches of the posterior trunk are the iliolumbar, lateral sacral, and superior gluteal arteries. The iliolumbar artery, the one you can see here, this is the iliolumbar artery, giving its lumbar branch and iliac branches. The lumbar branch is the fifth lumbar artery, as we discussed before, with the vasculature of the posterior abdominal wall, supplies psoas major and quadratus lumborum muscles, and gives spinal branches to coda equina. It's extremely important to know this fact, because in surgery we do not manipulate the artery so as not to cut the spinal branches to the coda equina. It gives an iliac branch that's deep to iliacus muscle and goes to the anastomosis around the anterior superior iliac spine, together with the superior gluteal, superficial, and deep circumflex iliac arteries and lateral circumflex femoral artery. This is the iliolumbar artery. This is the superior gluteal artery, as you can see here. Okay? The lateral sacral artery, this is the lateral sacral artery, descends in front of the sacral foramina, parallel to them, and gives spinal branches also to supply the coda equina. The superior gluteal artery, this is the beginning of the superior gluteal artery here. It's a large terminal branch large continuation of the posterior division, and pass between the lumbosacral trunk and S1 nerves. Remember this. And pass through the greater sciatic foramen. This is the superior gluteal artery. After passage through the greater sciatic foramen, it's above the piriformis. Remember that. Okay, give superficial and deep branches, as we will study in the gluteal region of the lower limb. This is the superior gluteal artery. Okay, the external iliac artery runs along the medial border of the psoas major, separated by the fascia around the psoas major till the mid-inguinal point, where it becomes the femoral artery. It's the main artery of the lower limb. Crossed by the gonadal vessels, deep circumflex iliac vein, as you can see here. This is the deep circumflex iliac vein. Vas and round ligament of uterus and genital branch of genitofemoral nerves. Anteromedially terminal ileum at the right and the descending colon at the left. I'm sorry about the relations, but this is a thing that you must study with structures like vessels, for example. Branches of the external iliac artery. Inferior epigastric artery, it gives it on the anterior abdominal wall, medial to the deep ring, as we discussed this before. Enters the rectus sheath, remember, behind the rectus abdominis, ascends anterior to the arcuate line of the posterior layer of the rectus sheath, gives off cremasteric, pubic and cutaneous branches, and anastomose with the superior epigastric behind the rectus abdominis. And this is a connection between the external iliac and the internal thoracic, coming from the behind rectus abdominis. It's a collateral circulation for the common iliac artery. Collateral circulation. Deep circumflex iliac artery, anastomosis at the anterior superior iliac spine. This is the deep circumflex iliac artery. And the artery itself becomes the femoral artery. The external iliac vein, tributaries like the artery. The right is medial, then posterior to the artery. The right one, right external iliac vein, is medial, then posterior to the artery. The left is medial to the artery, as you can see here, the external iliac vein. It's a continuation of the femoral vein. The internal iliac vein, the veins at the greater sciatic foramen converge to form it, ascends posteromedial to the artery. Tributaries, same like the artery, plus some plexuses like superior and inferior gluteal veins, the internal pudendal vein, obturator vein, the lateral sacral vein, the middle rectal vein, the external rectal venous plexus, the vesical plexus, prostatic plexus, the uterovaginal plexuses. All these drain into the internal iliac vein. The common iliac vein begin anterior to the sacroiliac joint. This is the common iliac vein. Ascends to the end of to end at the right of L5. So the inferior vena cava starts at L5, slightly lower level than the L4 of the aorta, termination of aorta. Joins the other common iliac vein and form the inferior vena cava behind the right common iliac artery. The right, of course, is shorter because the inferior vena cava is on the right side. The right is shorter, vertical, and first posterior then lateral to the common iliac artery, posterior then lateral, crossed by the obturator nerve posteriorly. The left is longer, oblique, first medial then posterior to common iliac artery, see, then becomes posterior, crossed by the attachment of the sigmoid colon. And this concludes the vessels of the pelvis, the lymphatics of the pelvis, to lateral aortic lymph nodes. Lateral aortic lymph nodes are the common iliac, the external iliac, the internal iliac, and the sacral lymph nodes. Or all these lymph nodes drain the pelvis into the main groups around the aorta, and from it to the cisterna chyli, and from it to the thoracic duct. This concludes our talk about the pelvic vessels. I hope you got the maximum benefit from this lecture, and thank you very much for watching.